Hello, I'm Chris McCoy, AARP Arkansas Associate State Director of Advocacy and Outreach. Thank you for joining us on this live interactive telephone town hall to share with you some information on veteran and military caregiving and the latest veterans updates and benefits and resources from AARP and the Veterans Administration. I'm pleased to announce that we'll have some guests on the call with us today. First will be Crystal Pearson, BSN RN, Outreach Coordination and PACT Act Subject Matter Expert for Central Arkansas Veterans Healthcare System. We'll also have Dr. Marlon Doucet, Chief Emergency Medical Service, North Little Rock VA Urgent Care, Olive Phillips, Deputy ACOS, Geriatrics and Extended Care and Adult Day Health Care, Kimberly Brown, Social Worker, Adult Day Healthcare, Lori Cooper, RN, Adult Day Healthcare, and Monique Myers, Social Worker, Caregiver Support Program. AARP serves and supports more than 6 million members who are veterans nationwide. AARP Arkansas is home to 196,127 veterans statewide. AARP has been working to promote the health and well-being of older adults for more than 60 years, and we want to help you get the most out of life and your earned service benefits. For all of you on today's call who have served, we want to salute your service and sacrifice and thank you for joining us. For free resources specific to veterans and military families, you can visit aarp.org/veterans. Now, before we dive into questions, I want to take a moment to talk a little bit about the vital role that military and veteran caregivers play for our country. Every year, more than 6 million veteran and military caregivers produce more than $14 billion, with a B, dollars worth of uncompensated labor in order to care for their loved one and service member. Research conducted by AARP has found family and others who provide care for veterans spend on average $11,500 of their personal income on out-of-pocket expenses related to caregiving each year. Now, that's nearly about 50% more than what your average caregiver spends each year, which is right around $7,242. In Arkansas, these dedicated caregivers manage medications, prepare meals, help with bathing, feeding, dressing, and providing transportations and medical appointments, among other care tasks. And according to AARP research, military caregivers far outspend non-veteran caregivers in one category in particular: personal expenses, which includes paid help. So the financial challenges veteran and military caregivers face are often invisible or ignored. Many say caregiving has made their own health worse and that they struggle more with their own anxiety, depression, frustration. Despite this, millions continue to step up each day. So this is an interactive call, and if you'd like to ask a question, all you need to do is press *3 on your telephone keypad to be connected to one of our AARP staff members who will note your name, your question, place you in the queue to ask your question live. Again, to ask that question, all you have to do is press *3 now or at any time during this call. If you're just joining us, again, my name is Chris McCoy, Associate State Director of Advocacy for AARP Arkansas, and I want to welcome you to this important discussion. With me is Dr. Doucet, Chief Emergency Medical Services, Olive Phillips, Deputy ACOS, Geriatrics and Extended Care, Crystal Pearson, RN, Outreach Coordination and PACT Act SME, Kimberly Brown and Lori Cooper with the Adult Day Healthcare, and Monique Myers with Caregiver Support Program at Central Arkansas Veterans Health Systems. Now, let's go ahead and hear from our guests. I introduced them a little bit to you, but we'll have them introduce themselves, tell them a little bit about themselves, and we'll get kicked off from there. Crystal, would you care to start us off?
Sure, Chris. Thank you. Thank you for that wonderful introduction as far as all the great things that AARP is doing to support our veterans. So today, we do have Dr. Marlon Doucet here with us. Dr. Doucet is going to speak to you guys about great things happening with our new urgent care center. And then we have some very special guests, Olive Phillips, Kimberly Brown, and Lori Cooper, who all work diligently with our geriatric and extended care program. They are three very important people in relation to our adult day health care program. Monique Myers is instrumental in assisting with our caregiver support program, and she's going to educate us on what that looks like. Myself, I am a subject matter expert for the PACT Act of 2022, which passed in 2022, expanding healthcare benefits for our veterans. And this has made a huge difference in veterans' lives. We have paid out well over $1 billion in claims related to military environmental exposures that our veterans unfortunately have experienced throughout their time in the armed services. So I will be here to answer any questions related to environmental exposures or the PACT Act and to support our guest. Thank you. And
Perfect.
Dr. Doucet, if you, go ahead.
Nope, got to say thank you for the introduction, and we will move on to Dr. Doucet.
Yes, good afternoon. Thank you, Chris. I am Dr. Marlon Doucet. I'm the Chief of Emergency Medicine here at Little Rock VA. One of the words you'll hear out of VA is that we need to improve our access for our veterans. We heard and we listened. We opened up an urgent care center in North Little Rock at Building 170 at the Tobin Medical Center on the north entrance. We opened this up in June of this year. It has been wildly successful. The veterans absolutely love it. We thought we would see 1,000 veterans within the first 12 months. We have now surpassed 2,000 veterans in the first 6 months. So we're very excited about what we've done there at providing access for our veterans for that care that is not severe enough to go to the ER, but perhaps is an acute, urgent need that they cannot get in to see their primary care physician, or it goes beyond what the primary care physician feels comfortable handling. We staff this clinic with emergency medicine physicians, and we are already planning for expansion. Thank you.
Great. Thank you so much for that. Olive, would you like to give us a little bit of an opening remark for you as well?
Yes, thank you, Chris. So I am Dr. Olive Phillips. I am a doctorally prepared nurse practitioner at Central Arkansas Veterans Healthcare System. I serve in the role as the Deputy Associate Chief of Staff for Geriatrics and Extended Care. And I've been here for 22 years, and I'm really pleased to present this overview of our adult day healthcare program, which incidentally is one of 4 in the nation that's located within the VA. But this program is a day treatment program for veterans who live with challenges such as memory problems or mobility problems. But we also welcome veterans who have endured multiple hospitalizations over the past year, multiple visits to the ED. Other veterans that we also like to enroll are veterans who are living with social isolation or depression, or any combinations of the above. We recognize that we cannot predict all contingencies, so we do have a VHA directive that we follow to enroll our veterans, but our team makes a huge effort to enroll anyone that can benefit at all from the program. It has been one of the most successful and popular programs, not just from our veteran standpoint, but also from the family and caregivers, particularly for those caregivers of veterans who suffer from dementia that need a high level of care. So this program has been an essential support for the families and caregivers. I am also proud to state that we are designated as an age-friendly healthcare system, which is the gold standard for caring for older adults, and this designation comes to us from the Institute for Healthcare and Improvement. We have a wonderful team that runs this program, including physicians, nurses, rec therapists, physical therapists, and our goal is to welcome as many veterans as we can to support them functionally, cognitively, supporting families. We have a very dynamic program with a wonderful program manager who oversees this program for us on a daily basis. Thank you.
Thank you for that. Ms. Brown, would you like to follow that?
I'm sure. My name is Kimberly Brown. I'm the social worker for adult day health care here at the VA in North Little Rock. We reopened our doors in 2021 after COVID, and we have been able to service as many veterans as we can. It's been a change, as Dr. Phillips has said. We were one of only 4 facilities that was open in the country. They're still open in the country at this time after COVID. And so we did a lot of changes as it relates to how we make sure that we care for our veterans and keep them as safe as possible. And so I've been here. That program actually started in the 1980s nationwide, and I came here after COVID, and we have been working to make this program a success and be able to serve as many veterans and caregivers as we can. So thank you.
Thank you. That's fantastic. Ms. Cooper, would you like to add anything there?
Yes. Hi, my name is Lori Cooper. I am a nurse, RN in adult day health care. I have been with the VA for 17 years. I have been in adult day health care for 3 years now. It is a fantastic program. We're excited to share about it today. We have a team of a medical director, 2 RNs, and nursing assistants, dietary, and social work. So we're excited to share some of our program with you today. Thank you.
Thank you. It's fantastic. And last but not least, Monique Myers, would you mind introducing yourself real briefly?
Yes, my name is Monique Myers. I'm a clinical social worker. I've been with the VA about 14 years, and before I came to the VA, I worked with the Department of Defense with family advocacy. So I've worked many years with veterans and with active duty members. My husband's also a veteran, retired from the Air Force. So I've been with the Caregiver Support Program for about 3 to 4 months, not very long, but it is one of the best programs that I have been a part of at the VA. We have 2 different programs with our Caregiver program. We have the program of comprehensive assistance for family caregivers, and that's the stipend program where caregivers can actually receive a stipend. There's a tier 1 and tier 2, depending on their level of care, where caregivers can receive a stipend to take care of their veteran. This is a very comprehensive assessment process, takes several months, and there's a lot of requirements to qualify for that program. But then we have the program of general caregiver support services that anybody can qualify for. If you are taking care of a veteran and the veteran says to us, yes, this is my caregiver, this is a person who is taking care of me. On this side of the program, we provide support groups, education. We do fun activities. We just Friday we had craft corners for our caregivers, and our focus is with this program is to provide as much support, care, education, pretty much anything to the caregivers who are taking care of our veterans. And that's our main focus. And we try to do anything, we're open to suggestions like, what do you need that's going to make it easier for you and also for the veteran? So that is our focus. It's a wonderful program. I can't say enough great things about it. I'm glad to be a part of this program, and it's just a great program, and I'd love to give more information.
Sounds fantastic. And we're looking forward to learn a little bit more as we go along today. So thank you all for joining today with me here. Just for anyone that's joined the call, or just as a reminder, if you want to ask a question, this is an interactive call. So all you have to do is press *3 on your phone. You'll be connected with an AARP staff member who will note your name, question, and place you in the queue for a live question if you'd like. So I want to mention some free resources real quick before we really get underway. Timely information specific to Arkansas veterans, military, and their family. AARP online resources. It's a pretty useful tool. You can visit aarp.org/veterans for more information about our free resources here at AARP and tools available to you and your family across Arkansas. In particular, be sure to check out the Veterans and Military Families Health Benefits Navigator that brings together valuable information and resources to help veterans, families, and their caregivers navigate some health care options. Also, what you might want to check out is the Department of Veterans Affairs for Arkansas at www.veterans.arkansas.gov as well for their resources. So let's go ahead and get into this conversation here. So I talked a little bit about resources a minute ago that AARP has available for veterans and their families at the beginning, But how about over at the Veterans Healthcare Administration? Where would somebody start if they are needing to find information on services or benefits available to them? Is there a place where caregivers can go to gather information and some options? Crystal? Where would somebody start if they needed to find some information on that?
That's a great question and something that we obviously have to educate on regularly because the system is so large. So the very first step from our perspective would be for any veteran interested in any of the healthcare benefits that they are due would be to enroll in VA healthcare. The easiest, most convenient way to do that is by calling 1-877-222-8387. Option 1 will take them directly to the Health Eligibility Center, and they can get them hooked up with just the Veterans Healthcare enrollment process. From there, that is the most essential step to ensure that the remaining services, as we'll discuss later, that those eligibilities are, included. And that will determine a lot.
Perfect. All right. So, speaking specifically for caregivers, is there a place where caregivers can go and gather information and options? Ms. Myers, do you have any information on that?
Absolutely. So the Caregiver Support Program is nationwide. And so if you go to the Caregiver Support website, which is www.caregiver.va.gov, it gives you just a bunch of information about both programs. And then you can also call the national number, which is 1-855-260-3274. Got a lot of great information. Mm-hmm.
That's great. So we can just go to those locations on the internet or call those numbers that you guys mentioned, and they'll be able to start moving in the right direction if they have questions from that standpoint. So that's fantastic. Caregiving is often a full-time job in and of itself, and then finding the time to take a break, running errands, even a vacation, it can be difficult. Are there options for veterans and their families for respite care, for them to be able to get a break and get away from it a little bit? Ms. Myers, do you want to talk to us a little bit about some of those options?
Yes, absolutely. If you qualify and you are approved for the Program of Comprehensive Assistance for Family Caregivers, that's the stipend program, you do qualify for respite care. And when you are approved into that program, you get a coordinator. And you will have that contact information to call the coordinator and let them know I need respite. I need some time for myself, we're going out of town, or I'm having surgery, and I'm not going to be able to take care of my veteran. And they will provide you information on respite care or set that up. Now, if you do not, if you're not approved for, we call it the PCAFC program, and you're in the program of general caregiver support, we always refer the caregiver to their primary care team. Every primary care team has a social worker. And so we will usually refer them over to their social worker. We give them the name and the number and talk and see if they qualify and if they can receive that service.
Oh, fantastic. So, Ms. Phillips, is there a service that you think people don't know a lot about that would be really beneficial for them?
Yeah, absolutely. I don't think many of our veterans know about our adult day health care program. And I just want to remind listeners, for respite care, we also have inpatient respite care here for a week at a time if a veteran qualifies. This is wonderful for a family to take a vacation. And then we have, of course, respite care in the home. But as far as the adult day health care, this is also a respite care support service because these veterans can join us at 8 in the morning and leave at 3. And so this frees up the family member to, as you said, run errands or have just a little me time, because if we're not supporting these caregivers at home, we have a huge problem on our hands, because these are the people keeping our veterans out of long-term care institutions. And over 95% of veterans, when they are surveyed, they opt to age in their own home. So it's upon us within the VA and wherever we can to support these caregivers. And so, as Ms. Myers mentioned, our social workers are a wonderful resource of information once veterans are enrolled with the VA. And they will all have a primary care provider. Each of those primary care clinics have the social workers embedded there, and they're a great link to these services because, as Ms. Myers mentioned, there are so many services available. It is very difficult to even cover all of them, but the social workers are a wonderful resource to link our veterans to these services. Right now in our adult day health care, we're at our maximum capacity of 62 because we have to have safe ratios of staffing to veterans, but we do refer sometimes out to the community as well, and we keep a waiting list because we want to enroll as many veterans as possible.
Wow, that's an incredible response, right? To be at capacity, but it'd be a great opportunity for a lot of families. It sounds like to be able to take advantage of that, and as you said, the starting point of that is making sure that you've registered and hooked up with some social workers at the VA, and they'll be able to start to direct you in the right ways there. So thank you so much for that. Dr. Doucet, can you talk a little bit about the urgent care options available, or a little bit more about the urgent care options available to veterans in Central Arkansas? I know you touched on it in the introductions, but can you get a little bit deeper on that for us and give a little bit more information?
Sure, absolutely. So we have the large emergency room here at John L. McClellan, the big VA hospital, and we take care of urgent care needs in that emergency room as well. However, depending on triage and how busy we are, sometimes our urgent care veterans may have to wait a little bit before we get them back. We take the sickest people back and fill the rooms up as we can. And we are approaching about 30,000 veteran visits a year. So we're a pretty big, busy 1A facility. This is why we developed the Urgent Care Center in North Little Rock. And currently, we are open 8 a.m. to 4 p.m., Monday through Friday. We're talking about how we can possibly extend those hours, but we need to get some ancillary services available to be able to do that. But veterans can walk in at any point in time with an urgent care need in North Little Rock. We'll go ahead and get them triaged and seen. The average patient visit right now is right about an hour. So we're getting these veterans in and out on the average within an hour for their urgent care needs. And in addition to that, we have found a large number of our veterans that were seeking urgent care outside of the VA are now coming back to VA knowing that they have access to that care.
Oh, that's fantastic. Some great options there in an hour. That's one. I don't think I can get in and out of my urgent care in under an hour sometimes. So that's great.
Yes, we're outperforming the community, and that's what we strive to do.
It sounds like it. Doing a fantastic job for our veterans there. So as a reminder, everybody who's on the call, if you do have a question for any of our participants, please press *3 and you'll be directed to one of our AARP staff members that will be able to help you ask that question. So moving on a little bit, I hear a topic discussed within our veterans team meetings here at AARP in Arkansas from time to time about dental care. Crystal, can you talk a minute about dental care? Are all veterans eligible? Are there options for those who, are not eligible but can still possibly receive some level of care?
So you're not wrong. This is something that comes up a lot, and because it's very important, and unfortunately, the older that we get, the more issues that we seem to have with our teeth. So dental coverage is limited to those veterans who meet certain eligibility requirements. I will give you the three main examples. One is if a veteran is 100% service connected, and what that means is if the veteran has gone through the Veterans Benefits Administration / regional office, and they have been awarded 100% of service connected related conditions. So if they're 100% service connected, they're definitely eligible for dental benefits. If a veteran is 60 to 90% service connected for those related conditions, and they receive VA unemployability, they are eligible for dental benefits. There are other specific dental issues that are service connected at 10% or higher. And that means that if somebody has filed a claim and it's been found that their time in the service did cause their dental issues, as long as they're rated at 10% or more, they are eligible for dental coverage. And this is super confusing for many people. And so I do have some information if someone is just not really sure if they're eligible or not, because the VA does also offer enrolled veterans and beneficiaries of CHAMP VA to purchase dental insurance at a reduced cost through the VA Dental Insurance Program, which does not affect eligibility for VA outpatient dental services and treatment. So for specific information about the VA Dental Insurance Program, referred to as VADIP, we love acronyms around here. And I kind of like just saying that, VADIP. Anyway, VADIP, you can call them directly at 1-877-222-8387, Monday through Friday, 7 to 7 Central Standard Time. There are also some plans that are offered through Delta Dental of California and MetLife, but those are private dental insurance plans, and we do not have access to what their charges are for their programs.
Gotcha.
I hope that helps.
Well, yeah, no, that's great. I know we've had a couple of discussions, so it's one of those things where it's I think there's a lot of folks, it seems like, that might not know that there were dental options, and it's great to have that information. So 1-877-222-8387 if they want to get more information on that, right?
Yep.
Perfect. All righty then. So if anybody still, if we have anybody that wants to ask a question, *3 on your telephone keypad, that'll get you through the line there. But we're going to be starting to wrap up here. So what it would be, I think, a good thing to kind of pull it all together. There's a lot of stuff that we heard. It went over kind of quickly, but the main point that we wanted to do with this teletown hall was to get some information out there, get anybody who might have some questions about some of these resources and program options that, if you didn't know they exist, now you know they exist. Now you have some information of where to go to get more information about this. So, on behalf of AARP Arkansas, I really want to thank all of our guests today for taking part of this. I know you took time away from your schedules, and I really, really appreciate the opportunity to sit down and have a discussion with each and every one of you. And really, what I want to do is just give an option for our guests to have some closing remarks independently of each other. And you guys would like, we can just go down the list as we kind of started with. So, Crystal, would you like to begin with some closing remarks for all of our listeners?
Sure. So the main thing is that if you have any questions about your benefits, or if you're curious about what the PACT Act can do for you, and you want to know more about military environmental exposures, you can always contact me and my team here in the Special Operations Public Health and Safety Clinic at 501-257-4031. And we'll be happy to assist you in any way that we can. We understand that the system can be confusing and that there are a lot of different steps. So we're here. We're here to hold your hand or whatever you need. Okay?
Fantastic. Dr. Duse, do you have anything you want to add before we close out?
Yes, sir, I do. First off, it's our honor to serve the veterans of Arkansas. And one of the things I did not mention is that our primary care partners and the emergency medicine service are looking at, for veterans not in the central Arkansas area, looking at expanding the availability of urgent care throughout the state of Arkansas around our CBOC system, our community-based outreach clinics. So be looking for that to happen, hopefully, if we can get things approved in the next few years. So we'll have increased access there. And if you're a veteran and maybe you haven't signed up for veterans benefits yet and you need urgent or emergent care, we won't turn you away. You can show up and we'll try to get you eligibility done at the same time that you're checking into the ER urgent care. And we're just here to serve the veterans of Arkansas. And thank you for having us on today.
No, it's definitely my pleasure, and great things from the urgent care side of things, it sounds like. So appreciate everything that you guys are doing on that front. Ms. Phillips, do you have anything you'd like to add?
Yes, thank you, Chris. So in closing, I appreciate the opportunity to present today. We are very passionate about our geriatric care here in our GEC department, and I just wanted to ensure that veterans are aware that we offer comprehensive geriatric assessments with a team. Several people on that team, different disciplines. We offer this as an outpatient service, inpatient service. We also have inpatient rehab. And as far as our adult day healthcare, I just wanted to expand upon that service because it is not just a sitter service for the day. It is a very dynamic therapeutic program where we maximize potential to remain independent at home, enhancing physical and cognitive skills because through programs such as Sit and Be Fit, we have Tai Chi, yoga, drumming circles, wood turning. We keep our veterans cognitively alert by offering storytelling, trivia, music, quizzes. And our adult day healthcare program is actually stocked with an entire gym. We have a pool table, shuffleboard, and piano, all kinds of activities. And so the goal is, as I said, to maximize our veterans' ability to be independent cognitively and physically in their own home while really also supporting those caregivers. And a shout out to Kimberly Brown. She's our social worker. She provides group caregiver support to our families of these veterans who attend adult day healthcare, reaches out to them by phone. We have interdisciplinary team meetings with the family and the veterans every 90 days to make sure that we're on track and we're on target and we're providing the care that matters most to them. And so it's an honor to serve our veterans, and I appreciate the opportunity to highlight geriatric care here in Central Arkansas Veterans Healthcare System. Thank you, Chris.
Thank you so much for joining us. And you gave a good segue into Ms. Brown. So, Ms. Brown, do you have anything that you want to add for some closing remarks?
Yes, I do. Like it's been said before, ADHC, we really do care about our veterans, and we say here that if it comes with our veterans, we care about them 51%, then our caregivers come in a close second at 49%. We really do try to work to enhance and support not only the veterans, but their caregivers and their families around them. Like Dr. Phillips has already said, we really try to make sure that we engage veterans all day, whether it is physically, mentally, cognitively, things like that. And we also support our caregivers, because we are also a respite, we're a part of respite in that, like was said earlier, we provide, a couple of hours for the caregivers to do what they need to do and understand that their veterans, their loved ones, is in a safe environment so that they are able to be able to do what they need to do. Not only that, but we are an adult day healthcare, which sets us apart from adult daycares in that we are connected to the GEC. We are connected to our veterans, primary care doctors and physicians. And not only that, we do have our own medical director as well. So we have all these things in place to be able to make sure that we have that security net for the peace of mind for not only our veterans, but their caregivers. Also, if anyone has any more information or want any more information about us, they can call us at 501-257-3340. That is our main line, and and staff will be able to get with you and answer any more questions that you may have about the program. So thank you.
Thank you for coming on and talking to us all about it. I think it's an important thing, everybody, to note the distinguished difference between adult day health care and adult daycare. So thank you for making that point. Ms. Cooper, would you like to add anything?
Yes, I would just like to speak briefly about our referral process for adult day health care. A good place to start is by talking to your primary care team, and they can reach out to one of the team members in adult day health care and get you set up for a visit with us. As Kim mentioned, I wanted to make sure everybody got our phone number. Our contact number is 501-257-3340. That is the ADHC number, and it will connect you to one of our team members. You can call us. We're open Monday through Friday, 7:30 to 4, and you can speak to one of our team members, and we will get you set up to come in and do a tour of adult day health care and to meet with our coordinator, Linda Fuller. She's an RN, and she'll do a nursing assessment, and we will talk as a team, discuss as a team eligibility requirements, and once we've determined if you're eligible for the program, then we'll set up trial visits. Usually those are 30 days, and once you complete the trial visits, then you're fully enrolled in our program. So,
great.
Yes, if anybody has any questions, just give us a call at that number.
Right. So the number again, it's 501-257-3340. Call anytime between Monday through Friday, 7:30 to 4 p.m., right?
Correct.
All right. Thank you so much for joining us today. And then last but certainly not least, Ms. Myers, would you close us out with some thoughts?
Absolutely. So just to give some more information about the program of general caregiver support, we do provide training and support through in-person, online, and telehealth sessions. We do skills training focused on the caregiver and for veterans' unique needs. So we have a REACH program that focuses on PTSD, dementia, ALS, and Parkinson's. And so we can really focus with the caregiver on how to best take care of the veteran who might have one of these diagnoses. We provide individual support related to the care of the veteran. We do peer support mentoring. We love to do activities where we tell the caregiver, just come, we're going to have a craft corner, or we're going to have a camp caregiver fest. And we want you to come here and just forget for 3 hours that you're a caregiver and just have a good time and connect with other caregivers. So we also do those activities. We do trainings on how to build a better caregiver. Focus is a 6-week workshop. We also do health and wellness coaching, and that's individual one-on-one with the caregiver. This next year, me and Melinda, the other social worker in this program, we are creating a bunch of different workshops based on what the caregivers have told us that they need. They said we would like to have a training on how to be positive, how to stay positive. So we're doing a retraining the brain workshop. And so our goal is to provide as much support as we can to the caregiver, because a better caregiver is going to be better for the veteran, which is going to make the veteran better. And so we really focus on self-care to the caregiver. We're here for them, all week from 8 to 4:30. If they need a call, if they need to vent, or just need, just to ask a question. So we're always here for them. So it's a great program. It's an honor to be a part of this program and to help these caregivers and also the veterans. Also, right. Real quick yes, if you want more questions, if you want more information, you can go to www.caregiver.va.gov. It's a fantastic website. Or you can call the VA Caregiver Support Line, 1-855-260-3274.
Perfect. I was about to ask you how could they get more information, and you beat me to it. So thank you so much. Mm-hmm. Well, everybody, thank you so much for taking the time to join us today. Military and veteran caregivers face unique challenges, and they're far too often they face them alone or without a clear picture of what lies ahead. Some free resources that you guys who are listening can touch into would be aarp.org/veterans. You can reach the Arkansas State offices at states.aarp.org/Arkansas. And don't forget our friends over at the Veterans Administration at www.veterans.arkansas.gov. If anybody does have any lingering questions, feel free to contact AARP Arkansas during regular business hours at 1-866-554-5379. And I want to thank everybody for joining us today. Thank you for your service. Stay safe and have a great rest of your day.